Hi, I'm Will Curry, Chief Medical Officer here at Mass General Hospital. And we're here today to talk about one of our very important safety initiatives, which is the clinically significant radiology results policy that's implemented here at Mass General in early November 2023. This is an important safety initiative for our patients at Mass General and across the system, making sure that clinically significant radiology results get back to the ordering provider so that they can be followed up on appropriately. With that, I want to introduce Nancy Wei, the Associate Chief Medical Information Officer, to put into context how this new policy fits in with how we manage and take care of our patients. So Nancy, in the name of patient safety and our own responsiveness, are there other policies that support this or that maybe to guide our physicians in terms of their behavior and access?
Absolutely. At MGH, we actually have two policies that are in support of the MGB, Clinically Significant Radiology Policy. The first policy is the Clinician Availability and Responsibility Policy. This is a long-standing MGH policy that outlines the availability of both inpatient and outpatient ordering providers in order to be able to be responsive to critical results, particularly for our radiologist friends who are trying to get a hold of us with a critical result. It's really important to have our pagers and other means of communication available. And that policy outlines all of that. The second policy to be aware of is the Communication of Critical Results Policy, which encompasses not just radiology results, but all resulting areas, including the lab, even our cardiology groups, and of course radiology. That's that particular MGH policy is the Communication of Critical Results Policy, and the MGB Clinically Significant Radiology Results Policy is in alignment with it, and we link between the two policies extensively.
So important for us to always be available, and if we're not available, always to sign out our pager. That's an important part of patient care and for implementation of these clinically significant results policies. So it sounds like the reporting of clinically significant data and results of all kinds is not a particularly new thing at Mass General. And I wanted to talk to Mike G., Deputy Chair of MGH Radiology, about what really is new and significant in this new policy.
Thanks, Will. The new policy is a real step forward for all of our patients. For one thing, it's being applied enterprise-wide throughout MGB, so many of our MGH providers are having imaging studies on their patients performed at other hospitals across the MGB system, and so this policy will apply to imaging studies performed anywhere in MGB. For the critical and urgent findings, the providers will continue to get paged as they are now. For urgent results, the provider has the option to either call back the radiologist to have the radiologist close the loop, or they can acknowledge the result themselves in their Epic in basket. For the important results, that's probably where the most significant improvement will be seen. In the previous system, there was an important findings alert email that was sent from the radiologist to the provider. Now that's been removed and replaced by a result that's now appearing in the Epic in basket, and that alert is tied to the result in the radiology report that generated it. So I think for all those reasons, our providers should see a substantial improvement with the new workflows.
Yeah, thank you. I think this is really exciting, and we'll provide links in this email to all of these policies, as well as tip sheets for how to manage the results when they're communicated to you. I think this is actually a real improvement for provider experience in that it's all confined now to Epic. This is no longer in your email, in your inbox, in your Outlook, but this is now all within your in-basket or within the radiology reports themselves, which I think is a real advance. In a few months, there's going to be a part 2, and we'll come back to explain that part. This is the acknowledgement portion of this policy, where providers have to acknowledge receipt of these critical results. Later on, there will be an action piece based on where the Epic-based team, part of our safety program, will actually ensure that the appropriate actions, whether they're radiographic or based on other testings, will be implemented and scheduled. Of course, as a provider, you have the authority and the ability to determine what the appropriate action is, that we do not take that autonomy away from our doctors and teams. So thank you very much, Nancy, Mike. We're happy to accept any questions about this in email, But I think this is an important new advance and a unique advance, I would say, actually, for the safety of our patients.